हेलो एवरीवन, मैं डॉक्टर सागरिका एंड मैं लाइव हूँ इंडियन वैद्यास प्लेटफॉर्म पर। और आज का टॉपिक भी और आज के जो स्पीकर हैं डॉक्टर अनुपमा जी भी बहुत एक्सपीरियंस डॉक्टर हैं आयुर्वेदिक कंसल्टेंट हैं। तो आज का लाइव होगा विद डॉक्टर अनुपमा संतोष जी के साथ एंड द टॉपिक इज busting myths about infertility treatment in Ayurveda. So it's gonna be very knowledgeable live today with Dr. Anupama. Yeah, here she is. Namaskar,
Hello.
ma'am. Hello, ma'am.
Hello, Dr.
Good afternoon.
Hello.
How are
Good
you?
afternoon. I'm doing all right. Okay.
So, ma'am, yeah, please.
Maybe a quick introduction.
Yeah, let's
I'm
start the
Dr.
session with your small introduction. I have given your introduction before also, but I want you to also start this session with a small introduction from where you have done your BMS and right now what is your proper location and exact location of your clinic and क्या क्या आप अपने clinic पे practice करते हैं? What practices
Sure.
are in your clinic? Yeah, please.
Yeah. I am Dr. Anupama Santosh. I consult from Shrestha Ayurvedic Center, which is in Kormangla, Bangalore. My husband started our center in 1997. So we celebrated our silver anniversary, our 25th anniversary in 2022. So it has sort of become a go-to clinic for like an Ayurvedic family clinic. But I am personally more experienced with infertility cases. It's been more than 2 decades, more than 20 years now that I have been consulting only infertility cases, PCOS, and mostly gynec cases. And we use Panchakarma, and then we use medicines, and we use lifestyle and diet advice. Sometimes in my preconception consulting, I am just talking about the diet and lifestyle changes only, unless we actually come across something which the couple needs help with. So I believe that Ayurveda can deal with infertility in a very comprehensive way because we are looking at it in a very holistic way in every direction. We are not going full blast only on the reproductive system and trying to because we do believe that all the other dhatus, all the other systems are responsible for reproduction. It is not just your ovaries and it's not just your uterus, and I think that is where Ayurveda has a lot of advantage over other forms of the infertility treatment. Yeah.
Yeah,
So
ma'am. Because
when sure.
I guess in today's lifestyle, it's very common. Infertility is very common nowadays because of the lifestyle. You can say also in the end, you just have left your patient with multivitamins, calciums, and all, जो कि I guess sufficient नहीं रहता है. Even though when your reports are normal, and in allopathy there is only the solution is of multivitamin and calcium. So in that point of view, I think Ayurveda has so many things to do in
I agree.
these
A lot of
cases
things to offer.
like Uttar. Yeah.
Yes. And also, that's why I thought instead of talking about a topic in infertility, I thought I will try and bust some myths about Ayurveda infertility treatment, which I come across very commonly during my practice. So I just made a few points which I hear a lot of it. So I thought it might be useful because there is so much information and much more misinformation on the social media. Everybody seems to be an expert on infertility. ये ले लो, infertility conceive हो जाएगा. And your tubal block will be cleared in 5 days. ये योगासना कर लो तो tubal block चला जाएगा. There's so much, and people are desperate. Like I said, I have been seeing infertility cases for more than 20 years now. In the last 10 years, definitely the number has gone up. There's no doubt about it. Looking at that, the market also is responding with too many products, too many advices recently. So the first and the most common myth I hear about infertility treatment in Ayurveda is that Ayurveda medicines cause overheating of the body. बहुत हीट हो जाता है, तो it will not work. Heat हो जाने से you will not conceive, so it will cause a lot of heat. My first point against this is that your doctor also knows overheating is not good for your conception. So if you're meeting your doctor for an infertility treatment, why would the Vaidya advise something which will overheat your body? Okay, number one. Okay, number two is this concept about heat and cold. Heat is good, the cold is bad, or heat is bad, or cold is good. Is not the right concept. We need both, not just in the reproductive system, everywhere. Common sense itself will tell you, if you have a cold season, you're drinking something hot. When it's summer outside, you drink something cold. Right? In the same way, when it comes to infertility treatment, there are functions in the reproductive system. There are things in the infertility treatment which need certain amount of heat. For example, for ovulation, let us say there is a patient who is not able to ovulate. Okay, we all know that even the body increases the temperature by 1 degree during ovulation. That is how you can use a thermometer to find out whether you're ovulating or not. So in that case, heat is important. It is the treatment. But the same treatment, if you're trying to give it, let's say if she has a vaginal acidic pH very high, okay, which may be killing the semen, we are not going to give you some heat inducing medicine for that. Right? Or if the patient already has too much endometrium thickness, maybe like 12 mm, 13 mm, already it is growing so much. We are not going to give any heat inducing herbs which will again increase her endometrial thickness. So what I'm trying to say is that there is no concept of, that's not binary. This is bad, this is good. It's not like that. Your Vaidya will choose the right virya, the Ushna or Shita, whatever is necessary for your infertility treatment. Okay. And third most important point, whenever I write a prescription, most of them that do in infertility treatment, they're very diligent, meticulously, they will take the medicines. They will swallow the pills, they will take the kashayam, but the prescription will also have other advice, like the diet advice, how much water to drink, how much exercise to do, not overdoing, and what kind of exercise to do. Most often, this is not taken as seriously as the prescription is taken. Right? So according to the prescription, the Vaidya already has an idea how to balance all of it with the prescription with the other advices. He may ask you to be taking Nash gourd juice in the morning. The doctor knows what are the changes which can happen in the body with this prescription. My advice is, instead of listening to your neighbor or some influencer on the social media about all this, speak to your Vaidya. Tell them your doubts, clear it with them, because they are the ones who are trained and they know. Okay, it may be about overheating, it may be about anything. Speak to them, get back to them before deciding that overheat ho gaya and Ayurveda doesn't work for me. Okay, Ayurveda has far many solutions than an oversimplistic way of saying this does. Ayurveda doesn't work for me. Okay. So the second point I thought I will address today is, I see a flush of OTC medicines for infertility on the net. I mean, it is filled with medicines. Everybody promising conception. Every product promises conception, and it's the same product for everybody. Okay, and because they will be desperate, some couples are over 35, they feel that it is ticking, time is ticking, and they think, okay, maybe this will work, maybe that will work, and they will pick up and use them. Okay, what I have against them, and there is also this thing of trending herbs. Some herb will be trending at some point. A few years before, aloe vera seemed to be this amrita for everything. Take aloe vera juice, that too for infertility. Yeah. Some of the other herb will be trending. Right now it is Putranjivaka and Shivalingi. Just take this and you will get pregnant. Most of the patients don't even know that Putranjivaka is Shita Virya and Shivalingi is Ushna Virya. Some of them shouldn't even be taking the Shivalingi in such quantities. The dosages which are being prescribed on the OTC products are scary sometimes. They don't even know what they may be doing to their own bodies. Because, see, the most important point to understand is infertility is not like a fever. Okay. Fever, we need to do only one thing, to reduce the temperature. But infertility is far more layered, far more complicated. There's so many reasons. It can start from the HPO axis, from the hypothalamus, pituitary, ovarian axis. You could have problems in any of this or all of them. Then you may have a uterine factor which is not allowing to conceive, or an ovarian factor, or a tubal factor. There may be so many factors, and also in Ayurveda itself, it's been mentioned, Kshetra, Ambu, Bija, Kala, all these factors have to be considered. So when you're just picking up an OTC product, what is it actually doing to you? I mean, do you have that problem? Let's say if they say they have added herbs to improve your ovulation. Do you have that problem? You have an annual cycle, only then it will work. Otherwise, it can cause harmful effects. That is another big notion. No, Ayurveda mein likha hai. So why should we go to a doctor? I can buy it directly. There's so much information. There is video about the product. I will read it and I will do it myself. And when it becomes harmful, then all this will start. And then the Ayurvedic doctors are targeted. Then with side effects hai, wo hai, ye hai, and all that will start. But have you even gone to a qualified Vaidya, checked whether this is suitable for you, or what is suitable for you? Why are you unable to conceive? And then taken medication or treatment for that particular problem. Infertility is not this one block. Okay, I have infertility, take this, it will go away. It is not like that. Okay, which brings me to the
No, Ayurveda
big.
is not like that. Take
Not at
any
all.
pill and diseases will go.
Not
Ayurveda is
at
not
all.
like
Yes, you're also right, Dr. Sagarika. I mean, not just in infertility, in any case, we don't see anything as an oversimplistic. We don't see one symptom and we don't treat it. Right? We see the person, the rogi, the roga, the bala of everything, how chronic it is, and what is causing it, probably an occupational hazard, what is the nidana of it. And when it comes to infertility, we have two people to deal with. So it's almost like a detective work sometimes, to actually find out why it is not happening. If the answer may be in just a simple acidity or a constipation sometimes. But we are able to catch it because we are looking at it. We are not just asking them to do a follicular study, come back, okay, you're not ovulating, okay, let me give you medicines to ovulate. But when you're pushing your body like that without fixing the foundations, without fixing the other dhatus, your ovaries just become more fatigued. They are not going to produce a good quality ovum, right? And the COVID myth was a very popular one, that Ayurveda medicines don't have side effects. Okay, maybe I'll make a controversial statement now that they do have side effects. Anything, even home cooked food, it can cause problems. How is that a medicine? See, Ayurvedic medicines are, yes, they are. There are so many spices in your kitchen. They are close to food. They are natural. All of it is fine. But still, rasa pradhana is ahara. Virya pradhana is aushadha. That is, they do have the power to make changes in the body. Right? Like I was saying, थोड़ा ज़्यादा डाल दिया क्या, और dry ginger ज़्यादा डाल दिया, उससे भी side effect हो सकता है. Then how are you saying a medicine cannot cause a side effect unless it is prescribed properly, unless it is prescribed by a qualified physician who knows what he is doing? This is Ayurvedic, no? So no, how is it even possible? Right? So a few days back, I came across this somebody on the social media who was talking about the halim seeds. Okay, it is good for PCOS, no, conception. It's good for conception. I mean, it can increase the heat in the body so much. Unless you are having an anovulatory cycle or you are not able to get periods at all, we use it very differently. For every kind of conception, if you're going to use halim seeds, that too after your ovulation, which can increase your body heat so much, it can lead to a miscarriage actually. I mean, something like, because no side effects. That is a seed, no? That is so easily available. You just take it without, it can lead to a lot of these things, and then Ayurveda should not be branded as, something which is harmful, unscientific. When you are doing an unscientific thing of picking up something from a shelf or from an e-commerce site, you can't really blame the system itself, the doctors itself for doing that. I'm sure you will agree with me a lot. And I also agree with Dr. Piyush, he is spreading a lot of awareness against this OTC products and how it is marketed directly by bypassing the doctors. We have been trained, we have expertise in that. We didn't sit in on social media for 5.5 years and then become doctors, right? So my advice always is to go through the doctor. There's no harm in it. There's only a lot of benefit. And like you're also saying, Shatavari, nowadays there seems to be some awareness that we can go to a doctor. I think this is a post-COVID thing, to understand the immunity, to do something before you start trying to conceive. But all of them, most of them at least, the female will be taking Shatavari, the man will be taking Ashwagandha. Why? Because it is good for them. They will be taking for 6 months together. There is no duration, there is no dosage, whatever is written on that, whether it's suitable for them, not suitable for them, there is absolutely no awareness about it. I'm sure Dr. Sagarika has come across Shatavari and Ashwagandha in all the people.
Yeah.
No, I actually like to know it is natural, it is very good. And they don't realize that these are herbs. Ashwagandha also has a duration in which it has to be prescribed. And also sometimes the Ekamulika may not help, or Ekamulika may not be suitable for them. They may have to be added with some HT Madhu in some cases. Shatavari dosage may have to be, titrated. There were so many cases where I see that there is this unjudicious use of herbs just like that. Okay. That's all. The blindly taking any medicine which has an Ayurveda label or natural label or herbal label. That, and another thing is also that people don't realize that infertility is a big subject described in our Ayurveda Samhitas. Because I even heard one patient telling infertility shayad nahi tha that time. In that time, people didn't have so much problem with conception, so obviously Ayurveda will not have infertility, not direct infertility treatments written in it, and so we Ayurveda doctors may not have learnt about it. So it sort of surprised me, and also realized that this is maybe on minds of many people, that Ayurveda does not have infertility treatment. So I do tell them that it has been written in great detail, that too textbooks like Kashyapa Samhita deal with it, not just gynecology, with obstetrics as well, Vandyatva both. I mean, though male Vandyatva is written differently, but at least the female infertility has plenty of medicines, plenty of explanation, and plenty of description, which can be very, very useful to the patients. And they're far more gentler, safer than the procedures and the medicines which are given outside. Okay, so another brings me to this another myth that, one myth is that they think that Ayurveda medicines, if they're working, shayad usme hormones or steroid laya hoga. Because it's working. Okay? Other people, it's not working, because it does not have hormones or steroids. Because Ayurveda does not have, how can it work? Because the conventional infertility treatment, when they go to any specialist, and that is what they see. Most often they are given hormones for each and every function. Okay, and if we are saying we don't have hormones, then what do you have then? Probably it cannot work like that. So both sides are myths only. That of course we don't have any steroids or hormones, and we don't need any steroids or hormones. That is not the way we approach. Like you were mentioning in the beginning, in Ayurveda, everything is approached in every direction, right? So we are correcting your foundations. We are correcting as something as simple as your bowel movements, your acid levels in your body, and we are correcting your period. Okay, your mental health. Okay, we are also giving time to actually find out. When the patient walks up with a big file, we Ayurveda doctors are trained to look into those files. We have educated ourselves to understand what the procedures are, where it is going wrong, also do some procedures if it is necessary, and do the treatment with Ayurvedic lens, right? So I feel we have much more benefit. There is more advantage approaching an Ayurvedic infertility specialist, because she can give the best of both the worlds. She knows what your motor file has. She can explain to you. Sometimes I can tell you, there is this big file and they've gone through so many things, but they hardly know what is in it. They said this, they said that. Why did you do this? They have no idea. They don't know how to advocate for themselves. They don't really understand. It's just like, ye kar denge, to conception ho jayega. That's all. They have even people who have taken infertility treatments for more than 10 years. Okay, they hardly have any idea why it is not happening, why these things were done, why I have been escalated to an IVF or an ICSI or a more complicated procedure. So I definitely advocate that the people should consider Ayurveda treatment for infertility, because you will be able to understand what is going on. You will be able to speak to your doctor more freely and understand how Ayurveda will it, because it's not a protocol, right? There's no one single protocol. If you walk into an infertility clinic, first, okay, you do all the follicular studies, you do the day 2 test, you do HSG, all of it. But I have seen IUS done without even HSGs. I don't know what kind of protocol it is. They don't know how the tube is, but they're still doing IUIs. So you do 5 to 7 IUIs, then escalate it to IVF. All the while, we don't know so many times what is happening. It is like I am throwing a dart in the dark. Something may hit, something may not hit, right? But on the contrary, when you come to an Ayurvedic specialist, first thing they'll give you is time. Okay, they will give you time, they will hear you out, they will be able to understand all the reports in your file. If something is necessary, they will find out. And there are so many parameters which is not even available in other forms of medicine. They are not, we can look at the body type and understand. We can see the family history and there are any problems because of which she is not able to conceive. And most importantly, male infertility, we have plenty of treatment. Okay, my husband, Dr. Santosh, is very, very successful in male infertility treatments. After multiple IVF failures also, we have been able to improve that and have success in infertility cases. And also many reports are not at all done for the male partner because there are not much medicines available, not much treatment is available. So there is IVF after IVF after forgetting that 50% of it has to come from the male.
मैम अगर बात करें जैसे आप अभी बोल रहे थे कि आयुर्वेदा जो है उसके बहुत सारे प्रोटोकॉल्स हैं. ऑल्सो आयुर्वेदा आपके बल के अनुसार, आपकी जठराग्नि के अनुसार और ऋतु अनुसार चिकित्सा करता है. आयुर्वेदा इज नॉट सेम फॉर एवरीबडी. It's like different and vary body to body or person to person.
Exactly.
Yeah. So Ayurveda.
This is why it is, Dr. Sagarika, that people are picking up. It is so individualized and customized, but people are picking up one product for everybody. I mean, see the irony of the entire thing. You know, instead of taking the advantage of such a system which can tailor your own treatment just for you, which will obviously give you better benefit, we are picking up something from the shelf which is saying which will work for everybody.
Yes.
Right? So my advice is always that please see your Vaidya. You're definitely missing out on something as beneficial, advantageous and helpful more than anything else by not exploring Ayurvedic treatment for infertility, both for the male and the female factor.
Yes, yes, both are important. Yes, I guess everybody is clear on their point. There is no query raised in comment section. Dr. Anupama, it was very, very, very knowledgeable and very good session. I am ending this session on behalf of saying very thanks to you and for the information you have given to me and audience of Indian Vaidyas. Thank you so much, ma'am. Next to you.
Thank you.